Good morning. My name is Sierra, and I would like to personally thank you for taking the time to view this presentation. This is a follow-up presentation to the memo that was sent out earlier in the year in regards to promoting paramount healthcare within the Rosewood Health Community, also known as RHC. So, without further ado, let's get into the presentation. So, I thought I would begin by telling you a little bit more about myself. I am currently working as the health educator here at Rosewood Health Community. I have been with the company for a total of 8 years now and have been holding this position for a little over 6. As of now, I am working on completing the Registered Practical Nursing program at Georgian College. After I graduate, I would really like to move on to the RN program. I think it would be a fantastic way to further enhance my skills and knowledge, as well as build upon my work experience. When I am not educating myself, I like to volunteer at a horseback riding camp for the mentally and physically challenged. The athletes, as we refer to them, undergo an 8-week therapeutic program where they learn the basics from cleaning a stall, proper grooming, all the way to driving a pony under carriage. And just for some balance, and to pay the bills, I work part-time at Augusta Health Centre, just west of Toronto. The purpose of this presentation is not only to follow up to the memo that was distributed earlier in the month, but to bring possible solutions to the table. I also hope that this presentation takes more of a proactive stance in that the memo didn't necessarily identify any particular problems that were arising within Rosewood Health Community, but more so what could go wrong and how, as healthcare providers, can do our best to maintain that ultimate level of care that we are known for. This presentation will provide a couple preventative and proactive solutions to the issues that were brought to your attention earlier on. So, I'm just going to give you a brief overview of some of the solutions that we're going to be talking about today. So, some of the solutions that I would like to discuss today include a team building retreat for all staff, an anonymous hotline, and a mandatory core curriculum that all staff would need to complete every 6 months and upon date of hire. So, let's get into our first solution, a team building retreat. As the memo discussed, teams that work effectively and efficiently together not only provide the patient with a better hospital or clinical experience, but their chances of making a full recovery to their previous state of well-being are so much higher, which studies have proven. The memo went on and discussed what is meant by a team and how we can easily define it when talking about the field of nursing. But really, we're talking about anyone working on the front lines of healthcare. So, that can include physicians, that could include nursing staff, so both RPNs and RNs. It could also include occupational and physiotherapists, as well as the patient's loved ones or family members. Because don't forget, they're a part of the bigger picture. Not to toot our own horn, but at the corporate level, we are not aware of major issues with our frontline teams, and we intend to keep it that way by implementing a corporate retreat that would take place once a year. Let's talk a little bit more about what a corporate retreat would involve and how it would benefit you as a frontline healthcare provider. First off, it will take place in an undisclosed remote location. This is to ensure that all members are there simply for the team building exercises. We are also asking that you leave your devices, so any laptops, tablets, or phones, at home, as we want you to focus on the activities at hand. While simply spending time outside of the workplace can enhance your team building skills, to take it a step further, you will be encouraged to take part in a number of activities that will test your trust. They will also test your communication and your problem-solving skills, just to name a few. The best part? It's free to all full-time and part-time staff members. So, I will be sending out another memo around the beginning of the new year with instructions on how to sign up for this exciting experience. Okay, let's move on to our next solution. While it is a simple one, and who doesn't enjoy being praised or recognized every now and then for simply doing a great job or going above and beyond? The next solution involves both your fellow members of your team as well as the ones that you're helping, the patients and or their families. Remember, the families are part of the team, they're part of the greater picture. While understanding what it means to work as a team, we want to see that you can work as a team. And what better way to ensure you are being effective as letting the patients and their families be the judge? It'll work like this. If a patient and their family or another member of the team feels that you have gone above and beyond, they can nominate you for a Teamsters Award. So, an example of this was we had a young woman that was on the cancer floor who was only given a few short weeks to live the rest of her life. Unfortunately, one nurse went above and beyond to make one of her wishes come true. This young girl had had a horse for most of her life, and she had been in hospital for quite some time now. She really, really missed her horse, and this nurse went above and beyond by arranging her family to trailer the horse down to the hospital and arrange for the horse to meet this young girl at the loading dock of the hospital. To me, that will forever stay with me for the rest of my career as a moment where somebody went above and beyond. Anyways, it doesn't have to be that extravagant. The award will be presented to you on your floor without notification. Along with the award, your name will be entered into a yearly ballot to win a free, all-inclusive vacation to the destination of your choice. Again, this program, once approved, will be rolled out in the coming year with more information to follow. All right, moving on to our last solution. This solution would be less hands-on than the other options, but still just as effective, I feel. While the two other options took care of defining what it means to be a healthcare team and visualizing the effectiveness of working as a team through the eyes of others, whereas this option leans more on educating and examining your knowledge of the importance of a team in a clinical setting. The core curriculum would be completely company-wide, with all employees expected to complete the short online quiz. It would encompass relevant and current articles on the importance as well as skill testing questions on the benefits of acting as a team in the clinical setting. To ensure that the company is all on the same page, the program would be mandatory, with one's pay being garnished if not completed by the deadline. To stress the importance of this program further, staff would not comply would also be denied access to charting software on the center's computers, as well as being unable to operate point-of-care machines. So, for example, blood sugar machines. So they wouldn't be allowed to sign into that software until the core curriculum has been completed. Again, this option would not roll out until we are into the new year with information to follow. So, how often would you have to complete this? Well, since information is always changing with new advancements each and every day, we would be looking at the initial program on your date of hire or retroactively fitting it for those staff members already working on a floor and then requiring a recertification every 6 months thereafter. So, I know that's a lot to take in at once, but over the next couple of weeks, Rosewood will be holding a voting station on which of these options we should implement in the new year. I want to hear from each and every one of you. Should we host the team building retreat? Or we could rely on affirmations to keep the team building environment our center is known for? Or do we go a complete technological route and continue on in the digital age and keep everyone up to speed through core curriculum courses? Another option, don't forget, is to implement all of these ideas. Anyways, I would like to just personally say again, thank you so much for sticking around to the end of this presentation. And I hope that some of these solutions, if not all, will be implemented in the new year. Anyways, thanks again for your time. And on the next couple of slides are my references. Thanks again.